Hello, everyone. Thank you for joining us for today's webinar. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CU content with over 200 speakers, 700 courses, and 3,000 hours of CE. Today's webinar is Clinical Success for Lupus, Flat Wart, and Vitiligo with 40 plus years of herbal mastery with Dr. Jimmy Chang, sponsored by Evergreen Herbs. Dr. Chang has over 40 years of concentrated clinical experience treating over 500,000 patients, specializing in differential diagnosis and herbal prescription. Today's sponsor, Evergreen Herbs, is the perfect partner for Dr. Chang, as he has strictly purchased herbs directly from them for the past 30 years. His pharmacy has over 150 single herbs and formulas combined. If you're interested in starting a pharmacy just like Dr. Chang, you can order Dr. Chang's Evergreen Herbs webinar special and receive 15% off on the herbs he currently uses in his clinic. This includes formulas such as his famous astringent complex, Herbal ABX, and various classic formulas and single herbs. I'll send a link in the chat room for you to check out. This class will be presented in a similar fashion as its previous classes, so I will explain Dr. Chang's webinar for our new students joining us today. Dr. Chang's formulas will be listed in the Fang Jia Fang style, meaning formula plus formula. In addition, he will write a percentage after a formula to indicate its ratio in the prescription. Dr. Chang typically prescribes his patients 100-gram bottles or 150-gram bottles if they are not local or if the disease is chronic. Dr. Jimmy Chang, a widely known figure in the TCM community, has been instructing at eLotus for the last 2 decades, contributing to a substantial array of courses on our platform. For those interested in more pulse diagnosis, we suggest also enrolling in Dr. Chang's comprehensive Pulsinergy 1, 2, and 3 course series for foundational pulse diagnosis knowledge. For our new attendees joining us, let me familiarize you with our webinar room. Please set your chat from hosts and panelists to everyone so that everyone can be part of the conversation. To ask questions during the webinar, please use the Q&A box so that the questions remain separate from the chat room. And lastly, the quiz. The quiz for CEUs will be available by the next business day late afternoon for everyone with qualifying attendance. Now, let's get started with today's webinar and welcome Dr. Jimmy Chang.
Hi, can you hear me now?
Yes.
Okay, ladies and gentlemen, it's me again. Today is August 11th, 2025, Monday. We'll be talking about this lupus, flat wart, and vitiligo. This vitiligo is one of my specialists. It's very interesting. I'll be sharing my experience of using some certain herbs you never learn from your textbook. Okay, but in the beginning, we also have to talk about some of these basic concepts. You can tell what the patient's constitution is like from the appearance. And so what I'm trying to tell you that when the patient walks into your room and sits in front of you, then you can immediately tell what medicine should be suitable for him or for her, or what not good for this patient, despite of his major demand, headache, body pain, fatigue, insomnia, no matter what, we have the pre-decided combination for the patient like that. It decided from their looks, how they look. In other words, decide your treatment approach by their body types is very, very important because it works for me all the time and saved me a lot of strength trying to tell the differential condition between them just by their looks and the blood pressure measurement. They'll give a perfect, clear idea what to do. And this is new. What am I doing here with these two palms here? Wait, I'm sorry. Oh, okay. See what this for? This is red. This is pale and white. So this person must be very cold, and this person must be very hot. If it's a lady or man, doesn't matter. So what I'm trying to tell you this in the beginning of all kind of a pulse taking or diagnosis, I already, because when we try to check the pulse, inevitably we'll be touching their hands. So the feeling of the hands is cold or hot, give me a very clear idea of what to use. A freezing cold hand, that means the circulation, maybe blood qi deficiency. A hot palm like this, if a lady is around the 50s, maybe something wrong with her a hormonal imbalance. So if two patients like this, if, let's say, their mutual complaint is sleeping problem. I cannot sleep late. Doctor, I've been out of sleep for 2 months, and I can sleep do this one. So the cold hand and hot hands, the treatment will be totally different. And this one, no matter what, I always add a little 四逆汤, and this I'll add some liver detox, astringent, or for your information, I like to use my sugar combo for the hot hand, for the frequent urination, for the sleeping problem, for the mostly the skin conditions for the hot hand. But the cold hands, I always use 四逆汤 to enhance the circulation, put circulation throughout the body. So even for the arthritis, even it's inflammatory arthritis, I always add 四逆汤, like 20-30% to push the circulation through the small arteries to make the medicine go where we wanted it to go. Okay? And this is just for fun. This for the this is how you feel when the pulse. Like I said, you should imagine there are 3 springs under your each fingers. And when you push down, the rebound are mostly different. The middle one is low like this, means the middle, this spring is damaged, something like this. And this is the almost like the autoimmune condition. If there's a left one, so that's the weak liver, means what? Means sometimes with people with a freezing hand. And you're free to use my kidney yang combo, like 右归丸六子汤 十全大补四逆汤 for all the circulation, for all the energy for this. So this diagram just showing you that the feeling you're supposed to feel under each finger. There are 3 springs with a different strength of rebound. And when you feel it, you never forget it. You should put this graph in your mind all the time. This is the first time I introduce them to you. Please try to bear in your mind and okay. See, something like that. Interesting, isn't it? Okay. Oh, sorry. And what I'm doing here I'm presenting here the different type of human body. Like I said in the beginning, this is pretty normal. The skinny and pale. This is even more skinnier and pale. This is very strong. But don't jump to the conclusion this is a strong guy. Maybe he had good muscles, but not necessarily had good hormone. Maybe the strength is strong, the muscle is strong, but the body is tired. Sometimes like that. In this case, it's definitely similar to it's a young lady and an old man. They have the similar characteristics of being pale and weak and qi and blood deficient. Eat more meat, right? And when the person like this sitting in front of you with the low blood pressure, of course, 十全大补 is the first medicine that will come into my mind, no matter what. Even he is asking, I have a back pain, I have a joint pain, I still use 十全大补 and the 四逆汤 in addition to other, the joint arthritis herbs. And this like this is similar, almost the same. Oh, these two are more similar. When a lady like this sits in front of you, or a big guy like this sitting in front of you, and no matter what, they will have the same mutual complaint. Oh, I'm so tired. This big guy can be very tired, and this young guy can be very tired. This elderly, skinny people can all be tired, major fatigue. But now we don't use same herbs for them. We cannot use 十全大补 for this big guy, can we? Right? So same thing here. She looks tired too, but no matter what, don't give her 十全大补. Instead, we should use something to clear her blood, clear her dampness. Then the energy will come back, because after our herbs, her blood will carry more oxygen to the small ends. Then everything will be better. So by watching all this, you can tell what herbs to use. And this is the another easier graph for you to put in your mind. The qi deficiency, yang deficiency, so cold. Like I showed you in the beginning, the palms are freezing cold. I have several of this. Even the weather, now it's in summertime. Oh my God, their palms are like freezing cold. Oh, this is okay. And this is phlegm and dampness. Don't give him 十全大补. Yin deficiency, yin means real solid thing, like a blood, like a protein, like a hormone, like a lympho, and whatever is solid nutrition is in. So this guy might have a low blood pressure and heartbeat rate. Qi stagnation, everything is stuck. Blood pressure is low, heartbeat rate is low. Damp heat, little excessive heat, like something like this. But his palm must be hot. Blood stasis, we'll be talking about that. Blood stasis is something in between this. And special intrinsic, there's the other things, got nothing to do with the weather or what, something. Okay? Now, just for a few minutes, now you understand everything for you to use, what kind of formula, what kind of approach, strategy we should use for this certain patient. Yeah, different body type are absolutely not the same. See, the treatment for different patients. Even they have the same complaint. Actually, I learned this from elderly ladies, skinnies, 73 years old. She's complaining after my diagnosis. Her major request was, I have headaches and neck pains. I know. I say, I know. But I gave her my USA one. I gave her 川芎茶条散. Nothing worked. So finally, I found out her major problem is the freezing cold hand. So I gave her my kidney yang combo, like 6 seeds, 右归丸, or shen tang, anything I can think of to tonify the kidney yang. She said she feels so good. Headaches are gone, neck and shoulder, all better. I was kind of scared by giving her such a hot medicine, but she got better, and her palms become warmer next time. So it's very important to know the body type. It's not so difficult. Just feel the temperature of the palm. And this, my ba gua different pulses. These are the level. The 3 levels when you touch the skin gently, strong. The rebound, remember the springs under each finger? The rebound is strong. This is strong. Keep on pressing down, still strong. Then you can tell definitely something wrong with the head and the colon. And most important thing, interesting, is this one. Even the guy is big or skinny or hot or something, the right cun seems to be jumpy, but when you touch the pulse, the right cun become, when you press down, the rebound is very weak. Weak. All 3 levels are weak. Even he's strong or something. Even the blood pressure may be high. This is the spleen condition, is the abdominal discomfort and constipation. Definitely it's constipation. I don't know why. It's not solid heat in the colon. It's just a weakness in the colon. So constipation is definitely there, inevitable. So I hope you guys can study this entire this illustration carefully and connect them to your to the organs and pulse finds and their symptoms. You find this very interesting. And this one, lung and mouth. Actually, this is bronchitis, cough. If the patient is coughing, obviously, coughing in front of you, but his right cun is not like this, then it's not bronchitis, it's allergy. We'll treat it differently. So cough can from allergy and bronchitis. But this is the pulse for bronchitis, not allergy. Okay, and we talk about this stuff. The blood pressure stuff in the beginning, type 1 is high. That's the solid, excessive or deficiency, heat or cold. In this case, then you can directly tell there are things we cannot give to this patient. Even his major complaints, doctor, I'm so tired, I can barely get up to my bed. Still, blood pressure first. There are 2 things just the 2 things I just told my student this morning. No matter what, blood pressure first. No matter what of his major complaint. I have a back pain. I have a kidney stone. I want to lose weight. Never mind that. Blood pressure first. And the second one is the bleeding. A lot of ladies with hyperplasia or polyps in the uterus or cyst or any other reasons for the heavy, prolonged period. No matter what, do it first. Clear and stop the bleeding first. The 2 things that comes for the top priority. And if the patient is like this, high blood pressure, nothing else. Blood pressure first. And this one, low. Ooh, ooh. Low, low, low. That's easy. Deficient, we just simply give him 十全大补黄芪健中汤右归丸 just free to give anything. Eat more meat. So whatever he's experiencing will be better. Okay, what about this? High, I know what. Low. That's heat or cold. Actually, it's not much. I showed you earlier before the palm, the temperature of the palm, maybe it's not too cold, it's not freezing cold, it's not hot, it's kind of a natural. Then the patient's body is natural. It's not a neutral. In the middle, not too hot, not too dry, not too bad, not too cold, too weak. So that weak goes into the blood stasis. If the temperature is normal, we'll have to think about this. Stagnation. Then we must use some kind of blood movers, like 生痛煮鱼汤, like this, with the 血府煮鱼汤, something to clear the blood and make the bloodstream works better, and all the symptoms will be better. So simple. Just feel the hand, the temperature of the patient's hand. Cold, hot, normal. Yeah. And the type 4, systolic low, low, high. This is very common. You might encounter them all the time, every day in your practice. Excessive deficiency is this deficiency. So indeficiency means solid, touchable things in the human body. So what is not touchable or visible in human body is the qi, is the meridian. Acupuncture, in the acupuncture theory, we talk about a lot of 12 channels, daimai, dumai, whatever. No, but nobody actually saw them. It's totally impossible to see them on a human body or on an animal's body. Nothing, no such thing existing in the body like this a channel, long channel, hard channel. No such things. But we do know they do exist. And that's how we perform our acupuncture treatment. And theory based on that, on the invisible channels. That's kind of ridiculous, isn't it? But no, the channels are all young, existing, but not touchable, not visible. But the other things in the human body, in the animal's body, whatever, is visible and touchable is in blood, lympho, protein, hormone, all the secretions, thyroid hormone, any kind of hormone are all we call the in. This is the in. This is the typical in deficiency. If you have a chance to visit anybody who has been hospitalized for a while for any reason, their pulses are always like in deficiency. The high heart rate is high and blood pressure is low. That means this patient might want to eat more red meat to become better. Okay, let's get on to the business. The lupus, what are you? So the lupus has got a lot of reasons for lupus. UV light, certain viral infection, and the immune system. Mostly it's the immune system. Look at this guy. He's weak and tired and pale. And see, his palm may be hot. So when a patient like this sitting in front of you, so pale, so tired, and so red, and the blood pressure is low and heartbeat rate is fast, then you can directly tell something wrong with the insufficiency. And to be precise, is the immune system. The immune system too strong or too weak, it attack the human body, something like this. The pulse will be like this. It's either very, very low, Sometimes this section, this left one, if the left one is almost broken, you cannot feel anything under your middle finger on the left one, that's the autoimmune deficiency. And sometimes the left one is very strong, not weak. So is it immune system? Yes, the immune system is too much. So also attacking the human body. So both conditions we do, the treatment is different. But this one looks like typical, we use 五倍子, sorry. I use 五味子 and 北芪. This I use astringent and the liver detox or something like that. Different treatment. Even sometimes the patient come to me, hey, doctor, I was diagnosed with immune system. Okay, then you feel the pulse. It's either this or this. If it's all not, then say, no, you are not. Your immune system is good. Nothing to worry about. Correct. I always right. So, but of course, everybody, I mean, a lot of people have this immune system, immune problem, but not necessarily get lupus. So there are other reasons for that. But we can tell them by the symptoms. Eyes dry, this is insufficiency. This is the butterfly. This is the most typical symptoms. Kidney, urine, finger toes blue color or color stress, like we talk about, like Berger's disease. Remember? Brain, headaches, confusion, loss of memory. This is from right cun and left cun, weak and deep or something. Mouth ulcers, chest pain, breathe, suffering, joint muscles pain. So all kinds of pulses are in there. So none of the pulses are really specific, pointing to the lupus. So what do? We'll talk about later. And I like to address to this, hormonal factors. 90% of patients are women of childbearing age. How do we know the hormone condition? With auto-antibody production, it would be like this. This is the hormone pulses. See? Hormonal factor. So this is the hormonal pulses. This is normal pulse. This is the hormone area, the HEART7. The area is HEART7. So for female, the right hand side should not have any pulse. The left hand side should have some pulse. For a male, the right hand side should have some strong pulse, and the left hand side shouldn't have any. So if a lady has very strong pulse here on the right hand side, that means her hormone is out of balance. She's having too much male hormone instead of female hormone. And if a lady also have the very weak left hand side, that means the female hormone is very low. But what if they both are strong? Woohoo! Right hand, even the lady right hand side, left hand side strong, that could means the hyperthyroidism. The thyroid is too active. Or I hated very much the people taking thyroid, taking the thyroid hormone. Those hormones so strong, like pushing the gas pedal of your car too much, causing too much heat. The engine's idling too fast. So of course the patient will suffer all kinds of symptoms, headaches, insomnia, back pain, neck pain, stomach discomfort, just like a car. You push the gas pedal too much without any good reason, all the engine become too hot. And all the part of the engine will be damaged, just like a human body. So better be quiet. And for a man, the right-hand side is supposed to be very strong because the right-hand side is the male hormone. If not, even as a big macho guy just from the gym practicing weightlifting something, I still tell them, your energy is low. They always admit it. Even their muscles are so strong, but they're still tired. And if the right-hand side is weak, the left-hand side is strong. For elderly gentleman, that means his prostate is swelling stimulated by the female hormone. So we should conquer it, destroy it, cover it by using my sugar combo. Okay. My sugar combo is 栀柏地黄丸 astringent and M3. M3 is the 黄连解毒汤甘露饮蟹黄散 That's specially designed for sugar, but it's also good for hormone imbalance, for the weak liver, for excessive fire. Let's put it simple, for a patient with a warm or hot hand. You just simply use it. It's good for insomnia, good for frequent urination at night, good for skin, for acne and everything. I think it's a magical combination. We got a questions here. How about black skin? How I know the pale red? Yeah, I cannot. It's difficult to look at the color skins. Yeah, by heat or cold. Could you please repeat the pause for males? Male. Okay. For male, the right-hand side, this part on right-hand side should be strong. Left-hand side should be weak. That's the normal pause, okay? The right-hand side should be very strong. Bum, 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 bum. The left-hand side is weak. Otherwise, the female hormone too much in a man's body will cause a lot of emotional problem. Okay.